Somatic symptom and related disorders are defined by excessive concerns about physical symptoms or health. In the DSM-4 TR, these disorders were defined by physical symptoms that had no known physical cause, and they were labeled somatoform to capture the fact that the symptoms took the form of bodily sensations. Over time, it has become clear that it is close to impossible to distinguish whether some symptoms are biologically caused. Doctors often disagree on whether a symptom has a medical cause. Some people might have a condition that defies diagnosis because of limits in medical knowledge or technology. Indeed, most people experience at least one mild, unexplained physical symptom at some point in their lifetime. Somatic symptom disorders involve major distress or energy expenditure regarding a somatic symptom or symptoms. People with somatic symptom and related disorders tend to seek frequent medical treatment, sometimes at great expense. Although people with these disorders are the most frequent consumers of medical care, they are often dissatisfied with their care. For many, no medical explanation or cure can be identified. They often view their physicians as incompetent and uncaring. Even though there is clear reason for concern about these syndromes, somatic symptom and related disorders have been criticized for several reasons. First, there is incredible diversity among people diagnosed with these conditions. Some people develop somatic symptoms in the context of anxiety and depressive disorders, whereas others do not. Some may have medical conditions that provoke the symptoms, others may not. Somatic symptom disorder and illness anxiety disorder are defined by health concerns that are a cause of excessive anxiety or involve too much expenditure of time and energy. Now, these are very subjective criteria. What is the threshold for too much concern or too much energy expenditure? And the diagnoses of somatic symptom and related disorders are often considered stigmatizing by clients and by clinicians alike. Perhaps because of these concerns, the DSM-4 TR diagnoses of somatoform disorders were rarely applied, even when the symptoms seemed to fit the diagnostic criteria. The DSM-5 Committee on Somatic Symptom-Related Disorders made two changes in hopes of addressing stigma. They removed the criterion that symptoms be medically unexplained from somatic symptom disorder, and they changed the name of this set of disorders from somatoform to somatic symptom and related disorders. Because these disorders are so newly defined, we don't have good epidemiological evidence about these specific disorders. Extrapolating from what we know about DSM-4 TR diagnoses, concerns about somatic symptoms and illness anxiety tend to develop early in adulthood. Although many will experience these concerns throughout their life, the symptoms may wax and wane, and for some, recovery occurs naturally. In one study, only a third of patients with DSM-4 TR somatization disorder still reported multiple somatic complaints or concerns 12 months later. Somatic symptom-related disorders tend to co-occur with anxiety disorders, mood disorders, substance use disorders, and personality disorders. Let's move on now to take a look at the somatic symptom and related disorders. They're characterized by prominent physical or bodily symptoms associated with significant impairment or distress. Actual physical illnesses may or may not be present. They include somatic symptom disorder, illness anxiety disorder, conversion disorder, and factitious disorder. Somatic symptom disorder has replaced what was formerly known as somatization disorder in the DSM-4. It involves a pattern of reporting and reacting to pain or other distressing symptoms. This pattern occurs for at least 6 months. It involves persistent thoughts or high anxiety about the symptoms. The person remains convinced they have a serious disease even when tests rule out illness. In about 10% of cases, symptoms are early indications of a medical condition. A person with this disorder may worry excessively over a certain bodily sensation, such as stomach pain. They may believe the sensation indicates a serious illness such as stomach cancer, although tests have ruled this out. They may go to great lengths to investigate their physical symptoms. They may see multiple doctors or pay for additional tests not covered by their insurance. It's important to remember the pain and suffering is real. It is authentic, whether or not it is medically explained. These individuals have high levels of worry about illness, and they think the worst about their health. Another diagnosis in this category is illness anxiety disorder. It is a chronic pattern of preoccupation with having or contracting a serious illness. And again, the pattern must be present for at least 6 months. What makes this different from somatic symptom disorder is it involves minimal or no somatic symptoms. There is a high level of anxiety, and it's strongly associated with a person's cognitions, or their thinking patterns. It's also known as hypochondriasis. There is a preoccupation with the idea that one is sick, along with a lot of anxiety about one's health. These individuals are easily alarmed when they hear about someone else getting sick, or when they hear about an illness in the news. And their concerns do not respond to reassurance from their doctors that they are fine. Another diagnosis in this category is conversion disorder, also called functional neurological symptom disorder. It's a condition in which you show psychological stress in physical ways. The condition was named to describe a health problem that starts as a mental or emotional crisis, a scary or stressful incident of some kind, and converts to a physical problem. For example, in conversion disorder, your leg may become paralyzed after you fall from a horse, even though you weren't physically injured. Conversion disorder signs and symptoms appear with no underlying physical cause, and you can't control them. There may be motor, sensory, or seizure-like symptoms, inconsistent with any recognized medical disorder. Motor weakness and abnormal movements are the most common symptoms among children. And individuals are not consciously faking symptoms. They believe the problem is genuine. There was a mysterious case reported in Leroy, New York in 2012 when several teenage girls in the same high school developed unexplained tics. This situation attracted national attention when a possible cause was thought to be conversion disorder. You can see a report in one of the videos in this unit. Interestingly, when school ended, the mysterious twitching ended. Factitious disorder is a serious mental disorder in which someone deceives others by appearing sick, or by purposely getting sick, or by self-injury. Factitious disorder symptoms can range from mild, such as slight exaggeration of symptoms, to severe, previously called Munchausen syndrome. The person may make up symptoms or even tamper with medical tests to convince others that treatment, such as high-risk surgery, is necessary. Symptoms of physical or mental illness are deliberately induced or simulated with no apparent incentive. Individuals are usually unaware of any motive. A factitious disorder is not the same as inventing medical problems for practical benefit, though, such as getting out of work or winning a lawsuit. Although people with factitious disorder know they are causing their symptoms or illness, they may not understand the reasons for their behavior. So it differs from malingering, which is faking a disorder to achieve some goal, such as an insurance settlement. If an individual deliberately feigns or induces physical or psychological symptoms in another person or even a pet in the absence of any obvious external rewards, the DSM-5 diagnosis is factitious disorder imposed on another. This condition is sometimes referred to as Munchausen syndrome by proxy. Factitious disorder is mysterious and hard to treat. As I've already mentioned, the DSM-5 has made some dramatic changes. The DSM-5 criteria for somatic symptom disorders have changed. The former criteria required a more extensive history of physical complaints and many more somatic symptoms to be identified. This change creates concerns that more people could potentially be diagnosed with somatic symptom disorders. The DSM-5 also eliminated the medically unexplained documentation aspect of the criteria and focuses more on the degree of distress and impairment caused by somatic complaints. The elimination of the medically unexplained terminology creates concerns that a psychiatric diagnosis will be given to those with legitimate medical concerns about diagnosed medical conditions.